Hello, welcome everyone. Delighted that you could join us for this webinar on distanced community-based research. My name is Johal. I'm co-director of the Community Engaged Research Initiative, and we're happy to be partnering with Dr. Nick Blomley from SFU Geography Department on this webinar. I just wanted to begin by recognizing that we're on the territories of the Musqueam, Squamish, and the Tsleil-Waututh peoples. My parents are immigrants from India, but their families originally come from Pakistan and were dispossessed of land in that colonial partition. And I grew up in the interior of BC in a place called Williams Lake, the territories of the Shawetma, Tixekal, Zatsul, and Chilcotin peoples. It's important that we recognize and think of these processes as ongoing processes that reflect, impact the present day as well. It's very difficult to think of a context in which the present pandemic has not affected everyday life, and certainly inside the university in terms of research and teaching. It has had massive impacts, and particularly for those people who work in community engaged or community based research, it had massive implications. Just by way of a background, there is a Q&A feature in the Zoom function, and as we get into a few discussions with the panelists and some questions and introductions, you'll have the opportunity to post questions, and we'll be getting to those a little bit later during the webinar. So please do jump in and throw in questions as the conversation starts moving. We are recording this session as well, and it'll be available afterwards. Due to limited time, we might not be able to get to all of the questions, but please do leave them in there. And if there's other ways for us to follow up, we'll certainly try to do that. I'll give a background. The Community Engaged Research Initiative SFU is a special project of the Vice President Research Office, and we're really here as a social infrastructure at the university to help researchers, faculty, grad students, and communities to work in community engaged research. And really excited that we have a wonderful panel with us today to help us think through some of the challenges that come up in this particular moment. With us today is Alissa Greer, Assistant Professor, School of Criminology at SFU, Jeff Masuda with Right to Remain, Associate Professor at the School of Kinesiology and Mental Health at Queen's University, Scott Neufeld, a Vanier Scholar, Social Psychology PhD candidate, and soon to be faculty member at Brock University, Samantha Pranteau, community organizer with TORO, Tenant, Overdose response organizers, and Claire Shopton, MA student in the Department of Geography at SFU. I'm just gonna begin asking for each of the panelists to introduce themselves a little bit and maybe just share some initial thoughts on how the present situation has impacted their work. I'll start first with Alissa.
Thanks, Sam. Yes, my name is Alissa Greer from the School of Criminology here at SFU. My main interests are in drug policy and participation in sort of a range of different settings, so in research, practice, and policy. I have several different projects on the go, mainly with people who are marginalized or structurally vulnerable. And one of my projects where I wanted to talk to people who use drugs about their experiences in drug policy debates and their perspectives on drug policy reform around the overdose crisis and within COVID now. That was supposed to start right around the time of COVID, and I was supposed to be doing focus groups, and so I've run into several obvious challenges around that, and so I've had to navigate that and I've had to go back to community and talk to them about that, and so I'd be happy to talk more about that on the webinar today.
Great, thank you. I'm going to move over to Jeff Masuda.
Well, there we go. Thanks, Sam. I'm actually located over in the cradle of colonial Canada, Kingston, the land of the Haudenosaunee and Anishinaabe, based at Queen's University. While I have a number of my foot in a number of communities across the country, I think I'll probably be speaking today mostly about the work that I do in Vancouver, along with Nick Blomley and Sam Pranteau, who is also on the panel. For me, the onset of the pandemic was a very challenging experience, I think, similarly to a lot of other people. I would be remiss not to also mention I'm the father of, along with my partner, who also is a full-time professional, of 2 elementary school aged kids. And being a parent of young children definitely has a big influence on one's experience of the pandemic, and including our ability to continue to maintain our commitments in the community. That said, the work that I do in Vancouver with my colleagues, some of which are there, but many are also dispersed or distanced, even in the non-pandemic times from Vancouver. We're working mainly to use research to support tenant organizing in the SROs, primarily in the downtown east side in the city. And so, because we're something of an already distanced team, the idea of being distanced is in some ways not new to us. We're used to the technology, we're used to the platform, we're used to, the relying heavily on email and other forms of communication to maintain our relationships with each other. And we've been doing this. I've been work in the downtown east side for over a decade. We, the Right to Remain Collective, have been now together for over 3 years. Because of the distance that we're at, one thing that we've always known is the importance of getting together and being together, and also the importance of relationships. And for us, the turning point of the pandemic was the threat of the distance on our ability to be in relationship with each other. And so what I can contribute to today's call is why relationships are so key, so central to community-based research, and what we can do using our existing tools, technology or otherwise, to help each other through the challenges that we're all facing in very different ways. My challenges are just the practical challenges of workload and whatnot. The challenges of people in adverse housing circumstances are myriad and severe, and being involved in relationships with tenant organizers and with researchers and other allies, I think has been something of a lifeline for a lot of folks. And I know others on the panel will probably have other similar things to say.
Great. Thank you, Jeff. I'm going to go to Scott now.
Hi, folks. My name is Scott Neufeld, and as Sam said, I'm a PhD candidate at SFU in the psychology department. I'm hoping to finish up in the next couple of months. I grew up out in Langley on the unceded territories of the Kwantlen First Nation. Grateful to live here in East Vancouver on the territories of Musqueam, Squamish, and Tsleil-Waututh nations. And so I've got 2 projects that are community-based that are sort of on the go and have been very much affected by the pandemic and distancing. One that I've been involved with for about 3 years now is related to something called Research 101, which was a series of workshops that I helped to design and facilitate back in 2018. That was funded by the SFU's Office of Community Engagement and partnered with Hives for Humanity. It's received a lot of support from UBC's Learning Exchange as well, amongst others. And so out of that work, we wrote this manifesto for ethical research in the downtown east side. And that really was integrating a lot of various folks from community organizations in the neighborhood, their perspectives and experiences on what goes well with researchers and what hasn't gone so well in the past, some of their hopes and expectations for what better practice could be from researchers in terms of perhaps more respectful engagement. And so through that project, I've been really privileged to be in conversation with folks in the downtown east side that have a lot of connection with researchers, and being able to think through questions of research ethics with them over time, and also to be in conversation with folks at research ethics boards at SFU, UBC, and Providence Healthcare through that work. So I think that's maybe uniquely what I can bring to this conversation today is some of that thinking and a bit of a liaison between community perspectives on ethics and institutional perspectives on ethics. And then where that sort of most come into play for me recently is with my own dissertation work, which is a 2-part study. It's a series of focus groups and an online review of how anti-stigma campaigns that target stigma towards folks who use drugs, how they represent people who use drugs and the problem of stigma. So I've got a community advisory board that's made up of a bunch of folks from different organizations like Vandu and BCA-POM in the Downtown East Side. And so I was very fortunate to have collected all the data, the focus groups in community last fall. I really don't envy anybody who's still trying to do data collection, but it's the being able to continue to find a way of holding those CAB meetings online and at a distance that's been put to a stop for now. I did actually finally was able to have my first CAB meeting online yesterday. So just some reflections from that process is what I can also contribute.
Thanks so much, Scott. I'm going to pass it over to Samantha.
Hey, good morning, everyone. My name is Samantha Pranteau. I'm part of the Swampy Cree Mesquistic First Nations. I go by pronouns them and they, also known as Dancing Water. Part of 4 generations living, working in the Downtown East Side. I've been part of the Downtown East Side SRO Collaborative for the past 4 years, maybe more, who knows? I'm losing track of time here. Been with the Right to Remain project for 3 years as well. I'm a member of Vandu, I'm a member of WARS. I was on the board for 3 years, the Western Aboriginal Harm Reduction Society. I'm on about maybe 25 different committees in the Downtown East Side. I'm also the program coordinator for the TORO project, which was a pilot project that was started back in 2016 with the opiate tax that was only supposed to last 6 months. And here we are 4 years later. I was the first person with lived experience hired, first person who used drugs, first Indigenous person who was hired onto the program, and now I'm running the program. So a lot of what I am bringing to the table is the work that I do in the Downtown East Side that I've been dedicated doing for the past 4 years, quite exclusively in the private SROs of the Downtown East Side, where the most vulnerable populations of folks live. I myself was homeless for many years, and I was living in a private SRO. Just recently living now Olivia Sky, which is a nonprofit housing right on the 100 block of the Downtown East Side. And what's changed through the pandemic, the TORO project, I'll be able to explain a little bit more about it, but we basically started in 10 to 12 private SRO buildings in the Downtown East Side. There's approximately 100 of them in this community, housing about 4,500 individuals. Up to 40% of them identify as being Indigenous. Through this pandemic, we've gone from 10 to 12 buildings to 60 buildings. We now service over 2,000 individuals and private SROs in the Downtown East Side. So we've expanded quite rapidly to meet the needs of the individuals who are the most isolated and vulnerable people of our community. So I'm here to bring a voice for those who can't bring their voices to the table today, and just bring a perspective on how indigenizing the work that we do in this community should be put on the forefront, and how that looks, and what indigenizing Indigenous peoples within their Indigenous lands look like. So thank you so much for having me here on my relations with Rich.
Great. Thank you so much, Sam. I'm going to pass it over to Claire.
Hi, everyone. My name is Claire Shopton. I'm an MA student at SFU, and Nick Blomley, who organized this panel, is my supervisor. And I'm coming to you now from the stolen land of the Willamette people in Portland, Oregon, where I grew up. And so as part of my experience during this pandemic, I decided to come back to Portland, Oregon. So along with the need to be 6 feet away from everyone, I'm additionally distanced during this time. My research is around the legal geographies of housing precarity, especially as it intersects with governance, property, and human-animal relations. And I work with the Drug War Survivors, DWS, who are based in Abbotsford, BC. And they're a group of mostly precariously housed organizers who work around issues that the street community in Abbotsford face. So around the criminalization of housing precarity, they do harm reduction work and other projects as well. And this is one of the first research projects that I've been involved in, being an MA student. So at this moment, I'm trying to figure out how to do research, how to do accountable and reflexive research, and how to do research during COVID. And this was the time, this summer, this term for me as a student, when I planned to be building relationships, to be thinking about what type of questions would best serve DWS's work. And with the time constraints of my MA, that has gotten pushed back, but an MA is not unlimited. So something that I've been thinking about a lot during this time is how to rework this project and mostly to change the order of when I'll do things, to try to still do community engaged research while also like having a high standard of what that means.
Great, thank you so much, Claire. A number of you mentioned the importance of relationships and doing community-based and community-engaged research. It's already complex and labor intensive in terms of doing that work, let alone during a pandemic. And in the context where a number of you are working, there's already emergencies going on. The number of deaths related, driven by fentanyl in the drug supply were 170 in May, and the numbers in June haven't come out, but might even be higher. And so there's a lot that comes up already with complex processes of research. And wondering what you see as the particular challenges of community engaged research and engagement created by the COVID distancing requirements, and what gets lost in the process. I'll just leave it quite wide open as to whoever wants to jump in here. So. I feel like Jeff has something to say.
Yeah, happy to start. I mean, it was interesting, our experience, and I will speak partially on behalf of both Sammy and Nick, because the three of us were literally, or perhaps figuratively, I'm not sure which, being chased by the virus. We were all on an exchange trip down in LA, right as things were starting to unfold there. We all managed to get back to our respective homes in time, I guess, but in only a matter of, it seems like, days on our return in early to mid-March, COVID hit, and as well as the consequences of COVID hit like a shockwave. And it really sort of like left all of us, the researchers, the community partners. We have SRO tenants who are an integral part of our research team. We were all sort of left in a state of something of bewilderment, and routines were disrupted. And one thing that I think I quickly realized, I suppose, just in terms of relationships, is just how unequal that initial impact was for all of us. I mean, we all felt it. Our lives were all disrupted. But even just in terms of who was talking and who suddenly stopped appearing, who suddenly stopped talking, was quite apparent. And that was certainly part of the shockwave that we tried to react to within our group, which was reaching out and checking in and thinking about ways we could accommodate that, because things like access to technology are highly uneven. Sammy will be able to speak more about their use of technology in keeping up the organizing in the community. But within our own research team, it was quite apparent that we were not able to even rely on, communicate with each other. Things as simple as cell phones weren't available in some cases. So that was a real challenge to our to the cohesiveness, I guess, of our group. But also, even when we did start finding ways to get in touch with each other, and I can speak more about that in a bit, about how we used research as a way to reconnect with each other. I think that might be an interesting learning point. But another one of those initial parts of the shockwave was we were all sort of like in the state of shock and trying to learn new ways of being and new ways of talking. And it really became clear the extent to which the whole pandemic was being experienced through the same filters of class and race and gender and indigeneity. And we were all sort of trying to grapple with things like, what does it mean to be physically distanced or socially distanced at the time? What is, why is it important to isolate? And just this language was just so, so inappropriate to people who were on our team were living in contexts where the idea of distance and isolation was just completely anathema to their daily lives. And so that even that the language was creating a whole nother layer of anxiety, I suppose, but also real consequences in people's decision-making about what they should be doing with their everyday lives. Should they be going out to secure food? Should they be locking themselves down in their rooms, and so on and so forth? And so in those early days, it became very clear to all of us, we needed to figure out a way to confront some of those filters and to check in with each other and to find practical ways to both learn to understand what was going on, and in so doing, in the learning, or I guess the research process, also find novel ways to support each other through. And so that's, we're now 3 months into it and things have changed, circumstances have changed, but I would say the level of anxiety and uncertainty has not abated. So those are just a couple thoughts on relationships and some of the fissures, I guess, that have happened as a result of the initial shockwave.
Thank you, Jeff. Scott, Sam, did you want to add to Jeff's comments? Okay.
I mean, I think what Jeff was pointing out with the technological inequality, I think with the pandemic, certainly every kind of inequality has just been magnified. I mean, it already existed, but as we've grown to rely on, various technical forms of communication more, or online payment has been a big issue for us. It just reveals how differently positioned people are in these research projects that we're trying to collaborate and build relationships and navigate those inequalities through relationships in community partnerships. But, me in my privilege can say, actually, on the whole, my family's experience of the pandemic has been probably good for our mental health. We've been, at home. I got 2 kids. My partner is working at home. Less commuting time. We're totally fine in most respects. And for some of my collaborators in the community, they're, absolutely going crazy by themselves in a tiny apartment in the downtown east side. And so that's been, just highlighting those inequalities, I think has been, just revealing and cause for reflection. And I think it's also been positive in some ways in that I've been able to support and connect with, my friends who are my collaborators with my work, and be a support to them as much as I can. But in terms of, just highlighting those inequalities in technology, I think the pandemic there's been this kind of assumption, everything just shifts online, which is simply not easy for everyone. In terms of access to Wi-Fi, access to devices, access to phone plans, or even just the know-how to set up Zoom and that kind of thing. And so that's been a barrier for sure. Certainly made things like online CAB meetings much more difficult to organize. And the other thing has been payment. Typically the way that I've worked with my research projects in the downtown east side is the expectation and is really paying people in cash day of as you do your work. That's, the economy that exists. And that's not possible for a variety of reasons at the moment, or we've been told it's not. And so it's put me in this strange position of having to encourage and try and support collaborators to open a bank account for the first time in their life, which is, people haven't done that for lots of good reasons. And so it feels very strange, and probably, potentially I wonder about the ethics of that, of saying, could you please try and get down to Pigeon Park and open a bank account, so I can pay you for your participation in this project. Otherwise, you'll have to discontinue your participation. It just feels wrong. But nevertheless, that's sort of, the guidance that we're working under from the ethics board at UBC. So I think it's highlighting those inequalities and just the strange things that it's led to has been a challenge and a learning experience.
Thanks, Scott. Sam, do you want to jump in?
Yeah, I just wanted to touch base a little bit on what Jeff was saying there. So at the end of February, we were in LA, and, even when we were there, we got the calls, from, our friends who knew information before many others did. And then immediately we went into panic mode. And luckily I was there with Jeff Masuda and Wendy Peterson, who's somebody who's worked very hard for housing rights and improving habitability in the downtown east side, who just has, 30 years of experience and a vision of things to come. So we went into panic mode, immediately started mobilizing people in Vancouver, even over the phone and through the internet, to immediately expand from 10 buildings to try and get at least one contact in every single one of the 100 private SROs. So that was the goal. So it went from being in our cozy 10 to 12 buildings to being like, oh my God, if this comes to the downtown east side and it comes into the private SROs, it's going to impact us, in a way that is going to be devastating. We're already dealing with a triple pandemic here through the opioid crisis, the homelessness crisis, and a tainted drug supply crisis. And, so this was just another thing where we're like, okay, this is another thing we got to put on our plate and just start to deal with. So immediately we went into emergency grant writing mode to try and to tap into emergency funds. We started reaching out to other organizations to see, okay, can we get more people like myself to continue organizing so that we could expand very quickly. So then immediately we hired another 4 people. We brought them onto our team at full time. And then it was just go, 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 get into those 100 private SROs, door knock on every single door, make sure people know what's coming, figure out who the tenant lead is in that building. Do they have a phone? Do they not have a phone? How do we get the phones? And then immediately it was okay, let's contact TELUS, let's contact Shaw. Let's get 500 phones, let's get 6 months plan paid for on those phones, because people are living in situations where, out of these 100 buildings, 20% of them maybe have Wi-Fi, 20% of them maybe have a kitchen. So, people have, no access to anything, and elevators that are broken for, half a year at a time. So we went into that go, 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 go mode. And it really was just how do we mobilize people in a very short period of time and get as much data as we can in that week or 2 week period, so that we could support people to stay in their homes for a 14-day isolation, to make sure that we bring in food sovereignty into the mix too, because that's a huge piece that we could start talking about as well, and just making sure people have access to hygiene products. We put out a call out for volunteers. We started a website. We started fundraising. We started a whole distribution site. We started drivers. We started a whole COVID response to it. So we moved very, very quickly. And the only way that we could have done that was by empowering the people, the tenants themselves who are living in the buildings, who are already building on communities of care, and just figuring out how that we could resource those folks and still get money and food and supplies to them, and doing it in a safe way that didn't put more people at risk. Because at the end of the day, 97% of Indigenous people have a spike in deaths over the past year from the First Nations Health Authority. And at the end of the day, people are still dying in their rooms alone for many, many reasons. And part of that is, also having access to safe drug supply. So that's a whole other thing too. I'm on the Coalition of Peers Dismantling the Drug War. And it was okay, how do we also get, safe drugs to people as well, and make sure that we protect drug users who are living in these situations too, and seniors in Chinatown. But I'll give some other people some space to talk. As you can see, there's been a lot of work done, and we've been working around the clock to make sure that we continue to save lives together.
Thanks. Alissa, Claire, did either of you want to jump in on how COVID has affected your research process?
Whoops, there, I'll unmute myself. Another thing that I want to echo a lot of the things that folks have already talked about, but something I've been more aware of over the past couple of weeks is, as there have been different constraints to DWS's work, and being able to meet as often, being in as much contact as would happen before the pandemic, other types of work in Abbotsford haven't stopped happening, and other people who connect with each other haven't stopped. And so, for instance, the Abbotsford Police Department came to a meeting recently and introduced this plan that frames sweeps as empowering, basically, and it's this new governance model that they've created and coordinated with many different people on many different quote unquote stakeholders, and are now coming to talk to the people who will actually be affected by it very, very late in the process, with a lot of their framing as momentum behind it. And so as there have been all these different challenges to work through about finding a meeting space, getting everyone connected, those other types of things just keep coming up as well.
Thanks, Claire. Alissa?
Yeah, thanks. I also want to, there's been so many amazing points that have been made already, and at different times I wanted to jump in and be like, yes, I totally agree. But just drawing on some of the points that have already been said, I think that it is really amazing how just seeing the community organize and all the work that's happening currently in community is really unbelievable. And it has made me really question whether right now is the time to do research, or if right now is the time to step up and contribute in other ways. And I know that unfortunately some of us as faculty or as graduate students, we have these other institutional constraints like tenure and all these other sort of annoying things that are in the way of us doing our work really meaningfully and thoughtfully. So yeah, I think that's been a real personal challenge of mine, trying to figure out where to spend my energy and where to spend my time, and to do work that's not only meaningful to me, but meaningful to the community. And that actually has a real impact right now, because maybe research isn't what I should be focusing on. I also wanted to mention that I was just listening to the way that Jeff was talking about how everybody was responded to the initial impact of COVID. And I was just thinking about how everybody deals with stress really differently. And so some people really, it like lights a fire under their ass and they get going, whereas other people really isolate and need space and need time. And I think for ourselves and for others, I just want to remind myself and everybody to be gentle with each other and with ourselves, because it's a very crazy time and we're adapting the best way that we know how. So, yeah.
Thanks so much, Alissa. When you talked about the nature of doing research or whether it's the best time or not, I can remember when I was working on my master's thesis, I ended up in Haifa in 2006, 3 days before the Israel-Hezbollah war broke out, and it just wasn't the right time. Sometimes events take over. One of the questions that come up, and we were just yesterday doing a session with graduate student fellows at CERi around ethics. There's the institutional obligations and of course broader questions around community engaged and community-based research as ongoing questions. But how have institutional obligations such as university research ethics acknowledged these challenges in this new context, and what could be done better, or what are new questions that come up related to ethics? So some of you have already mentioned these, but it'd be great if any of you wanted to jump in on this question.
I can just briefly speak what I've gone through, because I was going through the ethics process right as COVID started to happen. And I had a lot of concerns, especially around payment, which Scott alluded to already. And pay equity is something that I'm very passionate about and have written a lot about pay and labor equity in peer-based work. And so actually getting people honorariums and thinking about who can be included because of the way that we are able to either transfer money to them and potentially not transferring money to them. I reached out to the SFU ethics committee to see if they had any suggestions or like how this would exactly work. And they weren't that helpful at all. They just sort of put the ball back in my court, and which actually gave me an opportunity to go back to my community partners and have a conversation with them, and figure out what is the best way to do this from their perspective. Because and I think it was a really good reminder that ultimately we don't know what's best, but to work with either peer-based organizations or other community members to see if they have any ideas. And so in doing that, there were ideas like working with sort of having like a third person who could act as the receiver of honorariums or the receiver of money, who could connect with people who didn't have access to bank accounts. Another suggestion was using Visa gift cards as another one. Also because even a lot of places right now don't even take cash. So having cash doesn't always work for people. And then other people, I don't know if people on the webinar know, but other people were wondering about whether there's some sort of like token system available online, like some sort of like anonymous where like your name's not tied to it, almost like a PayPal, but not. I couldn't find anything, but that was another sort of innovative suggestion. But anyways, those are my experiences.
I can go next if that's okay. Yeah, I didn't check the attendee list, so I'm speaking truthfully. I have nothing but positive things to report on, from my university in terms of the ethics, both the ethics side and the finance side. You know, I remember 2 whole months ago or 3 whole months ago, you kind of got this sense from the messaging that was coming out from universities. It's like all of a sudden we are all frozen in time, like frozen. You just feel like everything must stop. The only people that are allowed to keep going are people that are directly working on COVID vaccines or whatever. And all other research is non-essential, I think is the term that was used, which is a bit absurd. And it was that sort of like, oh, all of a sudden the mentality was, oh, we need to stop doing whatever we're doing. But of course, we quickly realized it's more unethical to stop that which we've already started and committed to than it is to find other ways to keep going. And so I very quickly wrote a letter to my ethics board saying, we're a community-based project. People are heavily implicated and we've made commitments to be working together. So we need to keep going and we need to keep paying them and we need to keep doing the research. And what we quickly realized was that the research we were doing, which was a lot of different things, but two pertinent elements were interviewing, doing interviews with having people, our tenant researchers interviewing their neighbors about conditions and things like that. But we were also interviewing each other as a process of collective learning and reflection. And we quickly realized that interviewing process was a really good tool to not only check in on well-being, but also to gather insight from the inside out about what the pandemic meant from the perspective of people who were self-isolating in their rooms, locking themselves down, or taking risks and going out into the community to meet their needs. And so my ethics board was very supportive of that, sort of like, we're not freezing, we're just pivoting towards a different way of doing research and what we're calling research or not calling research. And so that was really helpful. And another example, a new project that Sammy and I are undertaking together along with many others in the community is a project that doesn't even have ethics approval yet because it's so new and it's focused on indigenizing tenant organizing. And I'll just say very quickly, again, even without ethics approval, because it's a brand new project we're just embarking, that it was, again, my university's finance department said, like, we need to roll this out because we committed to starting this, and salaries are tied to this, and the process needs to begin, despite the fact that everything is like totally upended. And we managed to get our first year funding released, right, so that we could at least start the process of starting to plan. And again, weekly check-ins with each other, which Sammy and others there are doing on our research team, just to see how things are going, how we're managing, how we're caring for each other and for our extended networks. So I think those are really positive examples of some of the ways in which, I guess, that for maybe I shouldn't be surprised, but it was pleasant to feel I had institutional support behind me in doing the kind of work that we do, and knowing that research isn't just about the collecting of the data, it's about sustaining commitments. And so that's been so far so good.
Yeah, and a big part of that too is like through this process, you know, like we've done interviews in the past where it was this very, you know, methodical process, and we had to go through a lot of ethics, and but you know, through this pandemic, we've had to have data collection. It's been essential in our work, you know, so we've gone to, you know, doing a side project and some interviews. You know, maybe under 100 interviews, to interviewing up to 70 tenants per week on everything from, you know, access to hygiene supplies, maintenance issues, food access. So like the data that has come out of this has painted a picture that nobody else has. The province doesn't have it, the city doesn't have it. But us as a grassroots organization, we have all that information, and we can tell you specifically out of these buildings, this percent, this percent, this percent, you know, and through the data, like that's allowed us to tailor and service people in a way that we could never do before. So we've had to put systems in place, you know, using technology, like Google Forms, and, you know, making sure we're calling people, and, you know, we're doing supply lists, and, you know, it's given us an opportunity to use that data to obtain more funding, or to show more need and to show gaps in the community, and to reach out to other organizations to help us fill those needs and those gaps. So we've used research as a way not only to reconnect with each other, because that's been so important too. A lot of us have used research as a way as an excuse to be together, and also to, you know, supplement our incomes and all these different things. But it's just been, you know, a really key part. And, you know, a lot of people still don't have access to phones or internet or cable. So we do have a newsletter as well that is reaching out to people in the private escrows called The Raven, and it's, you know, by peers for peers. And we have a COVID issue that's gone out. We have a second COVID issue that's going to be going out. You know, we have a wellness series that's going to be coming out, where people are encouraged to be active in their room, whatever that looks like, you know, and share stories of resilience. So there, you know, we have to be really creative in the ways that we're reaching out to people in our community and giving those lifelines. And we really can't assume that everybody is already on the Zoom train.
Great. Thanks, Sam. Before I go to Scott and Claire to share their answer, one of the questions that came in on the chat was just around, you know, we all work sometimes in these big, dumb, clumsy public institutions where the systems and processes don't work the reality on the ground. The systems don't interface very well. We function in the audit culture of universities. So this question of how to get honorariums out to people, these kinds of questions other people have as well in the audience out there. I'm just wondering if you could also perhaps, Scott and Claire, as you answer this question broadly around research and ethics, how there might be some trade secrets or workarounds that you've invented to get around some of the imperfections of our public institutions and processes that get in the way of the research work.
I can speak a little bit of some of my experience. I just wanted to say thanks to Jeff and Sammy for sharing some of what's been going on with your project. It's encouraging to hear how things have been able to continue and even increase during this time in terms of the amazing data that you're getting and all the work that you've been doing. So that's just really, really inspiring. I wanted to double back to something Claire mentioned about folks continue as normal with their work during the pandemic, whereas many others have sort of come to a standstill. And also something Alissa was saying about pay equity and labor. And that is that some of my experience has been with some of my collaborators in the Downtown East Side community specifically, that much of the frontline organizing and activism and care work that is so essential in this community through those organizations such as Vandu and WARS has continued in some form throughout the pandemic. And many of my collaborators are involved in that work. And so I think the halt on some aspects of their research work that is involved with me has felt a bit inconsistent for them. And I think what it highlights is some of the differences. And these are questions that we've been engaging for some time before the pandemic through Research 101, highlights some of the differences in community perspectives on risk compared to institutional perspectives and tolerance for risk in research. So I think absolutely nobody wants to be associated with an outbreak, especially not in the Downtown East Side. So universities and ethics boards, I think, are right to err on the side of caution there and say absolutely everything in person needs to stop. That's what UBC Prep has said, unless it's specifically COVID related, unless you're going to get reapproved for your study. But this halt that people have been talking about. But from the perspective of some of my CAB members, that's felt just strange to encounter and say, well, we're continuing as normal. I'm getting paid in cash every day from Vandu. And you're saying you're not allowed to pay me cash under any circumstances because it's too risky. And so it just really highlights that difference in what's considered a risk. And as people said, people have had very different responses to distancing and isolation. Some of my collaborators have said, I've been holed up in my room for months. I'm going crazy. Others said, yeah, I tried distancing for half a day and that was kind of it for me. I can't do it. So I'm just back out on the streets and it is what it is. So I think it's just really highlighted how differently people approach those very subjective questions around risk and what the stakes are. And so I think it's led to some frustration from CAB members to say, once again, institutions are perhaps maybe going a little bit too heavy on assuming that the Downtown East Side is so vulnerable, so needs to be protected at all costs. This kind of quick return to this very paternalistic view of the community, which many people have resisted for a long time, and it maybe feels like a step backwards to say, oh great, all of a sudden we're like this time bomb you just can't touch. Well, we're going to keep doing our work here in the community. You privileged university folk that are so worried about us, I guess you can just stay away for now and whatever. But I think that highlighting that difference has been something that's been made really clear in the last few weeks.
Claire?
I think I'm going to perhaps contrast with some things that other folks have said, in that I think that I've been institutionally encouraged to continue my research. And in that, as a graduate student, you have like certain dates that you're supposed to complete different parts of the process in order to keep receiving funding, keeping an enrolled student. I'm an international student, so visa status is relevant there as well. So for instance, I'm supposed to continue and finish my proposal soon, which feels really difficult when I don't think that I have the information to know what type of methodologies make sense. But to still write it down and put it out there as this is what I'm going to do, even if it'll change, is something that's difficult. But something I'm interested in, like all the ways that folks have talked about using research as a way to connect. It's really heartening to hear about and think about. And I haven't experienced that in my connections as much, but I have like my research connections have like shown me different ways to think about the issues that I'm interested in. So for instance, this is the time when I would have been spending a lot of time in Abbotsford supporting work in person. And instead, the work that's been most useful for them is for me to do different sort of gray document analysis, look at different reports that they're coming across and like, is this useful to our work or not? And that's been useful for me in thinking differently about how governance works and also about how I should structure my own research. And so there's, even though it's not like as much spending time with people as would be like ideal outside of COVID times, like other ways of contributing to work that DWS is doing have been useful to my research as well.
Thank you. Yeah, so in this rather kind of exceptional moment in time where various forms of work and research have been disrupted, in some ways there's a lot of innovations and change in methods that have gone on. Some of you have referenced some of those, but I wonder if you can speak to maybe somehow how your community engagement has improved in some ways, or how distancing has forced you to adopt and explore innovative ways of engaging, or asked you to adopt new methods that are actually working quite well in a certain way in this moment where you are forced to adapt. There's actually a lot of learning that we can share with one another and with people who are attending this webinar, because I think there's a lot of things have happened so quickly. There hasn't really been an opportunity to share some of those aspects, some of which might even be positive to some degree. Wondering if any of you like to jump in on that.
Well, I can jump in. Jeff mentioned that we have another grant and research project that we're working on called Holding Space. And, for me being involved on the underground movement of the Frontline for, over 4 years, working in a situation where funding is coming at 6 months, we don't know if we have a job in 6 months. The precarity of the work has put a lot of stress on me over the past 4 years, and being able to give me some space in my life to hold space for me to have some capacity and growth within my own leadership as an Indigenous person within my own community has been invaluable over the past few months. Through this process, one of the most beautiful things that has come out of it, is being able to focus more on my journey, my cultural journey, and others' cultural journey, and giving access to culture within private SROs and identifying other Indigenous leaders and figuring out how I can resource them and build them up as leaders in the community. I've been able to start taking Zoom classes online, starting, relearning my language. I'm 40 years old. My grandparents could speak our language. My mom could understand it. There was 17 children, and then now I couldn't understand it or speak it. And it's given me an opportunity to reclaim my language. I started a drum group online. I've been connecting with elders from all over Turtle Island, learning the most beautiful gifts and teachings and lessons and medicines. I have been able to regain that. So, and for the first time in my life, I've been able to look ahead 5 years, because this is a 5-year project, and it's given me space to do that for the first time. And as a 40-year-old woman, Indigenous woman, that is something that I never thought would be possible.
I can quickly just follow up just to speak to some of the ways in which the project that Sammy speaks about is, I guess, innovative is the term we're using. That project, that 5-year project, was funded or is funded by the Canadian Institutes of Health Research. And when we made a decision just over a year ago to, respond to some of those shortcomings that Sammy was referring to, that I think are even more laid bare in the context of COVID, which is the heightened level of precarity for Indigenous workers in the downtown east side, also Indigenous tenants living in SROs. really just putting the idea to a funder to say, you know, for 5 years, we don't necessarily need to collect any data. What we need to do is build capacity. And so credit goes to the funder for, and specifically the Indigenous Health Peer Review Committee for endorsing that proposal to enable that to happen. And so it was very timely that that came through at the moment that it did, that it allowed us to embark on that journey. And, you know, it's also, I think, a lesson just in terms of the response that Sammy speaks to, not only, you know, being able to take Cree language lessons through Zoom, but just to bear witness to the agility of the grassroots community. Really, you know, COVID really laid bare the limitations of the state and specifically the public health system and the capacity of that system. Of course, BC is an exemplar of perhaps the best that we have, but the limits are still very clear, especially when it concerns things like housing as a risk factor in COVID vulnerability and things like that. But it also laid bare the capacity of the community. And it's just been an extraordinary thing for me to witness very much at a distance myself, the ability of the community to come together in a matter of less than, like, you could count it in days, if not hours, to mobilize, to be able to reach each other through old tech, to resource people who are in adverse conditions. And I think most importantly, what Sammy was referring to in terms of their grassroots research, which is very much separate from any university context, to actually gather vital intelligence from within SRO environments back into the public health system. And I think that this metaphor of holding space really speaks to that broad, that broad mentality that maybe what is more clear now, which is we need to rethink the ways in which, let's say, the state or even universities collaborate with communities, which is like our agenda, our capacity, our resources, and then, you know, they provide the access or something like that. We really need to find ways to resource communities to hold space for themselves, and not constantly have to do this vital life-saving work, always chasing after the short-term funding, always with so many strings attached. You know, some of the funders in our host organization in Vancouver is the SRO Collaborative, headed by Wendy Peterson, as Sammy mentioned. And I guess maybe just another glass half full observation was the extent to which all of the funders who have lined up over the recent past to support the work, which is mainly focused on tenants' rights and habitability and living conditions, very quickly said that, you know what, whatever you think you need to do, this is as COVID was just hit the ground, whatever you think you need to do what you think is best. And that really provided the space for the collaborative to pivot towards a COVID response and to that basic resourcing. So I think that there is something of a broader lesson to be learned from that.
Claire, Scott, Alissa, did you want to jump in on this one?
I mean, that's really encouraging to hear once again from Jeff and Sammy. This sounds like just a really great example of what's possible in these shifted conditions. And once again, just applaud everyone in the collective for the really hard and amazing work there. The one thing I was thinking that's potentially, you know, an advantage or something that's gotten better as a result, I guess maybe two. One is just increasing some of that regular contact with collaborators just around caring for one another and trying to support one another beyond just research meetings or only connecting around work. So making those friendships maybe just even a little bit more real and about support and you know, showing care for one another. The other was just you know, this experience I had with finally getting a CAB meeting up and running on Zoom yesterday. For those it worked for, which was about half of the group. So it's a mixed thing in that certainly people are being left behind because of those inequalities. But for those for whom, you know, they're able to set it up and they're set up to receive payment online, it seemed like it worked really well. And especially, you know, people were commenting, it's great, I didn't have to leave my house if you have Wi-Fi at home. You know, and people feeling really comfortable in their own space. to participate at a meeting, to, do whatever they need to do to feel comfortable, whether that's using some substances during the meeting, which is less possible in other settings. So that felt like a bonus for sure, just that people could be really comfortable and at ease in online meetings like that. And I think it does, looking forward, it does open up the possibility of, continuing collaborations or things that maybe felt like we could only do this in person. Well, perhaps, there's lots of ways that we can continue this work from a distance, and make it easier to facilitate once those basic things are in place around Wi-Fi access, having a device, being able to set up to be able to receive payment online. The payment thing is potentially, once again, it depends on how it works out and how flexible, institutions are able to be in response. I want to go back to the question I think someone named Nick in the Q&A posted around, how can we use this moment to try and push for some of the changes around more flexibility in payment options with institutions. And I think there is hopefully some possibility there. I think just being able to explore what are the other options perhaps opens up a wider range of possibilities for ways of getting payment to folks that meets their needs, that suits their preferences. Perhaps it's cash, perhaps it's not. Perhaps they prefer to be paid direct deposit to their bank account, which isn't something we were doing before. Perhaps even somebody yesterday said, well, I have a PayPal account. Can't you pay me there? Which sounds really straightforward and easy for those that have it. So perhaps there is some room to open up wider possibilities there, which can just broaden that sphere of inclusion in terms of how people can get paid and when, and that it suits their needs. So.
I think a positive shift that's happened for me out of having to rethink research somewhat with distancing is that my undergrad research was also community engaged. It was with a anti-poverty community organization in Portland, Oregon. And the data that was part of that research was interviews, which I really like as a type of data. I love having conversations with people. They were confidential interviews. I was the only one who ever saw them. And so the different reports and presentations and then research article that I'm drafting that came out of that has the goal of all of those different outcomes has been for it to be useful to that community organization. But the interviews themselves were not something directly useful. And I've been rethinking that a bit. So one of my friends, Marina Chavez, has been doing this really interesting work around, she works with the SROC and thinks about how homes are created and maintained. And so she's been thinking about cultural probes and how folks can represent their spaces to themselves and also to her for her research through things like haikus and photographs, drawings. And so I see that type of data collection as something that's useful for her research, which is community oriented and community engaged, but also as also something that might be wonderful for people to hold on to. And I've been thinking about cultural probes and community mapping, sort of inspired by the anti-eviction mapping project that's based in the Bay Area, where researchers set up different ways to add to maps to track different types of community phenomena. And so with very little technical experience, people can add data points to maps, and then that mapping has continued past, I know, the original research project. So those maps continue to be useful for organizing. So it's changed how I think about deliverables for community engaged research.
Alissa, did you want to add to that?
Yeah, I just want to echo that. Yeah, I think that it seems that one positive is that there is more funding available. And in addition, I think is a bit of anxiety around the long-term or sustainability of that funding, or whether it's just tied to COVID. And so people are a bit skeptical of different policy changes and funding that's associated with COVID. So it'll be interesting to see whether government and institutions actually continue that beyond COVID. And then the other thing that I wanted to mention, which goes back to the person's question about payment, is I think one of the issues that institutions have is that anytime that we pay an individual in Canada over $500, they have to provide a social insurance number because there's tax associated with it. And so one way that we've gone around this, because my team and myself are not interested in collecting social insurance numbers or real names for that matter, it's not important to our work, is that we primarily work off the sort of stipend or honoraria system if people want to be paid in that way. And in that, we don't ask for names. People can put down whatever name they want. And so that's been one way that we've been able to pay people over the $500 and been able to get money out of our grants.
Great. Thank you. I'm going to see if each of you can sort of wrap up with a minute or two with anything else you'd like to say. And I'm going to invite Nick to respond back to the conversation and share some thoughts and further questions before we close off. But I'll pass it over to Jeff, if you'd like to share anything you haven't had a chance to say yet.
Well, maybe I'll just add one more really, really practical experience that we've had, and I'm not going to call it a success story per se, but it's definitely something that has been a positive feature or learning experience. So just going back to the inequities in communication and technology, we realized one thing that we could do practically would be to figure that out. It took a lot longer than I would have liked, but we actually, for our core team, which includes people living in SROs, we figured out a Wi-Fi plan to get portable Wi-Fi plans set up for them so that they can participate in team meetings and in interviews and things like that from their rooms, and also to share that Wi-Fi with people in their close proximity if they wish. It has mitigated but not perfected communication challenges because it's not super reliable. But if anybody that's on the call wants to know which plan we went with, which technology, what it costs, how to get universities to support that, would be happy to share that after the fact or whatnot, or just shoot me an email and I can tell you how we did it.
Thanks, Jeff. Sam?
Final thoughts? Just the importance of including people with lived experience in the work that you do, and making sure that you're putting, drug users, people with lived experience, Indigenous people front and center in the movement, and you include them along in the process. That's been one of the most successful things that we've done. With Coalition of Peers Not in the Drug War, we created a coalition with other group organizations and created an organization called CAPAL. So it makes up of Dudes Club, Wars, TORO, and the Coalition of Peers. So it allows us to distribute chunks of money to each organization so that you have a peer that can distribute money to the rest of the folks. So if you have a peer that can help through that process, that really works. Capacity building has been a big piece through this whole process as well, not just resourcing people. So, it was really important for us to help people, who wanted to set up a bank account. And literally it was everybody, because CERb payments were coming out, GST, there was a lot of folks who needed to know that process and how to set up bank accounts and things like that. So, it was a big piece in that capacity building, and then just being creative in how we paid people was a big thing too, and how we do that. And just working out with peers, okay, well, maybe are you okay with us not paying you every single time? Is there some people who want to be paid once a month? Is there some people, so it's just kind of being creative in that way. And then also working with other organizations that are already paying out peers, like working with Insight and working with MOPS and being like, hey, do you mind if we send, 10 peers your way on the same day you're paying everybody else, and if we can just e-transfer you the money and that kind of thing. So e-transfer has been a really big thing for us too. But yeah, I mean, I can keep going on. I'm just really grateful for everybody who's here today and the work that everyone's doing. And thank you so much for including you and allowing me to give a perspective into the work that we're doing here. And yeah, just really grateful for everyone, all my relations.
Thank you. Thank you, Sam. Scott?
Yeah, just I guess my final thought would be maybe just an encouragement for research ethics boards in the region and across Canada, if any members are watching, to, as best as possible, find ways of engaging community members who are best positioned to be able to evaluate what the risks are around research. I think so often we approach risk assessment, I know I do this in my own ethics applications, from a very limited perspective, that based on assumptions and stereotypes about community and individual vulnerability. And that can have, just create consequences that are at the very least frustrating for community members. But I think finding ways of involving community members, enabling them to bring their perspectives and their expertise on knowing what is going on in their communities into those decisions at REBs is especially important when things shift as they have with this pandemic.
Thank you. Scott, Claire?
Hi. I think the final thing that I'd like to add, besides that this conversation has been really useful for me and given me a lot of encouragement and things to think about, is that there are distinct challenges with community engaged research when you're a graduate student. And so I'd encourage anyone in the call who is a graduate student to be kind to themselves, and also anyone who supervises a graduate student to extend them a lot of patience and support. And that I've been very grateful for all the patience and support that I've received. But I've heard stories of people who have had less of that. And then also that I know that there's going to be resources for people who were on this call that are going to get sent out. And that one of them is this document that's been particularly useful for me that was sent to me by someone else who is a graduate student in my department. And people have compiled all these different ways to do socially distanced research, and many of them aren't community engaged, but many of them could be or are, and along with citations and ways to look up more of that. So those types of supports are also useful.
Thanks, Claire. Alissa?
Yeah, I think the only thing that I wanted to mention, and sort of building off of some of what other people have said, is that I don't think I think that people are really capable, and now might be a time to really think about the capacity building that we're doing with communities. So it's not that people aren't capable of joining Zoom meetings and using computers and engaging in these different ways. I think that it's on us as researchers and as allies to actually take the time to do that capacity building and to think about how we might be able to bring the community along with us in this changing time. The other thing that I wanted to say is that for people that technology isn't available to them, whether that's because of where they are in their community or even different parts in the world. I saw even there was a question about technology challenges in India. One way that I've gotten around this is creating trainings and creating things and just printing them off and mailing them and then going through them one-on-one over the phone. And it's worked really, really well. And it's been a way to connect with people rather than just having people isolate. It's been a really good opportunity to connect with people one-on-one. So I'd recommend that as well. And otherwise, I just want to say thanks for having me on the panel today.
Yeah, thank you so much. I'm going to pass it over to Nick Blomley to share some thoughts and questions and reflections on the conversation. Nick.
Thank you, everyone, for these really incredibly helpful contributions to this really important conversation. I'm so very grateful for the time you've given us and the audience who's participating in this webinar. So I'm Professor of Geography. I'm also researcher in residence at CERi, and I thought it would be useful to use that use CERi as a space to convene this conversation. It really came from initially from my own frustrations about the challenges of doing community engaged research, of doing any kind of social science research, but certainly community engaged research that's predicated on ongoing respectful relationships rather than just zooming in, zooming out under the conditions of where face-to-face contact was being disallowed by certainly my university ethics board. And it's heartening to hear from places like Queen's that there's flexibility in the system. So I'm hoping there's also flexibility in our system, particularly by way of recognition of the particular challenges of, as Jeff put it, maintaining ongoing commitments and honoring those commitments in a respectful and sustained way. So I wasn't quite sure how this panel would unfold, and I suppose I anticipated a lot more frustrations, and we've heard frustrations and challenges, but I've also been really heartened to hear positivity as well, and creativity. Creativity in terms of using tech, using cell phones maybe in ways that allow for new forms of engagement that we hadn't maybe thought about, or maintaining, as Scott put it, maintaining those friendships that don't necessarily require face-to-face, although face-to-face is still fundamental. I mean, you can't, I can't imagine distanced research in continuing and community engaged research. Those two do seem ultimately a contradiction. But creativity, and then it, as Claire pointed out, this remarkable Google Doc that where a whole variety of really interesting tools are being kind of proposed to use cell phones and other devices to engage in respectful forms of engagement and community organizing and community-based research. So that's wonderful for me. And also, I think there's also some really interesting lessons that's come out of this conversation. I mean, a reminder of the agency of community, and the fact that community is a lot more supple and flexible than hidebound institutions like universities. Sometimes there's an assumption that the university will bring resources to the community, and the community will then benefit from them. Sometimes that happens, but I think we're also learning from community how the possibilities that are out there, and the remarkable resilience that Sammy, for example, and the phenomenal work that Sammy's been engaged in, and many other folk on the ground in places like the downtown east side and elsewhere in Chilliwack and Abbotsford and so on. So and a reminder also about the maybe this is an opportunity to rethink some of these relationships between university and community that Jeff pointed out, particularly in regards to community engaged research. So thank you all for your contributions, and I'm very grateful for this is a continuing conversation, and we're going to keep learning. So thank you all.
Thank you so much, Nicholas, for bringing this idea to us at SFU's Community Engaged Research Initiative. And thanks so much, Jeff, Claire, Sammy, Scott, Alissa. It was a really important conversation. I feel like we just sort of opened things up, and this might require more conversations in the fall as new questions emerge. We had over 80 people join in. This is the first public event we've done, and we weren't sure exactly who would be joining in, and it's wonderful to see this is a really interesting conversation for others as well. I also wanted to thank Joanna Habdank and Tyne Johnson-Dillon from SFU's Community Engaged Research Initiative for doing all of the incredible work to make this happen, and also to meeting events and conference services for the work they did in having this come forward. If you go on to SFU's Community Engaged Research Initiative onto the website, you can sign up to our website, and as we do more public events, please do join us in the future as well. We're just getting off the ground, and thank you so much for joining us, and thank you to the panelists and Nicholas Blomley. Take care.